Okay, everybody can hear me all right?
Yep,
Yes?
got you, Russ.
Okay, great. Well, good morning, everybody. And I just want to say thank you for joining this morning. We are excited to talk about Volunteers of America, Chesapeake and Carolinas, the Hope Center. And I know many of our partners are on the line. And thank you for your collaboration. And we're just excited for what this is going to allow us to do to serve our communities most vulnerable. And I just want to just say welcome to learning more about Volunteers America, Chesapeake and Carolinas, what we do with the Hope Center. So I'm going to first, Donna, if you can share PowerPoint slide number 6. There's a poll there, and we want to kind of get centered in on who is here today. And if you can actually take the poll question is who do we have on the call today? And if you can indicate your affiliation, that would be helpful. So there it is, it's popped up. And if you can just take a moment to go through that, that would be fantastic. Wonderful. Without any further ado, my name is Russ Snyder. I'm the President and CEO of Volunteers America, Chesapeake and Carolinas. I have been in this role since January of 2009, and it's my privilege to serve this Church Without Walls as well as our Human Health Service organization. And we provide housing solutions throughout our region. So a little bit about Volunteers America, Chesapeake and Carolinas, and I'll be brief. We are part of a larger organization, a national organization that was formed in 1896. We have also been operating our local affiliates since 1896. There are 30 affiliates nationwide. Volunteers America, Chesapeake and Carolinas serves Maryland, Virginia, the District of Columbia, North and South Carolina. We provide a variety of services throughout those different states and the district. We actually have 7 different lines of services, including housing support that we do provide for many individuals in our communities. We're serving men and women with substance abuse issues. We're serving those with behavioral health challenges, those that are veterans and families that are returning from overseas or veterans here in the United States that have been our heroes for years. We serve the homeless. We also are providing supports for those that are returning citizens and to the Baltimore community. And last but not least, we're serving at-risk youth. So we are pleased to be part of this Hope Center, and we'll talk about that in just a moment. From a housing solution standpoint, one of the main areas of our focus has been, since I've been here, really just looking to build the production of low income affordable housing, moderate income affordable housing. And we're excited to tell you that we have formed a joint venture with our national organization to become a regional housing developer called Mid-Atlantic Neighborhood Development Corporation, where we now have 200 units of production of housing, affordable housing in our community, one in Prince George's County that we're getting off the ground, one in Baltimore, and one down in North Carolina that we're moving along with. So we're excited to be that resource and that housing solutions provider to many of those families as well as individuals that need our support. So it's my pleasure to introduce Dr. Belina Shaw. She is the Medical Director of Mental Health Services at the Prince George's County Health Department. She is board certified in general adult psychiatry, child and adolescent psychiatry, and addiction medicine. She is a Bloomberg Fellow at the Johns Hopkins Bloomberg School of Public Health in the area of addiction and overdose, and is currently pursuing a master's degree in public health. Dr. Shaw attended Yale University for undergraduate studies and received her MD from the University of Pittsburgh School of Medicine. She completed her psychiatry residency and fellowship at the University of Maryland, Sheppard Pratt, where she later joined the faculty of the University of Maryland School of Medicine before coming to the health department. So it's my pleasure, and thank you, Dr. Shaw, for being part of our solution to the community, the Hope Center. And we are looking forward to hearing about the importance of integrated care.
Thank you. Dr. Shaw, before you go, I'm gonna ask Reverend Gray to do a small invocation.
I was just opening the chat box. Good morning, everybody. Let us pray. Father, Mother God, thank you. Thank you for strengthening us to hold captive the joy you bless our lives with, serving through our church without walls. Help us to walk freely in your love. As patients grow in their ability to recognize and offset symptoms, help them to manage their wellness in the long run. We pray that patients can take an active role in their wellness, that the center helps them improve all areas of life for better health, that they address patients' mental and emotional barriers, encourage and sustain patient motivation, prevent the progression of chronic symptoms, develop patients' self-awareness, encourage patients to grow in knowledge and skills to better self-manage their condition for improved quality of life. Let the Hope Center always be a center committed to whole person and patient-centered care. Lord, help us to remember collaboration is key to all our services and allows us to care for the body, mind, and spirit of your children. Through this center, let us foster meaningful ways to provide services for the whole person. Father, Mother God, we ask that you bless the Hope Center and its efforts to provide whole person care for all involved are called to love and serve others. We pray that wisdom, kindness, and love guide all actions as your people, the center's clients, receive the whole person care needed to live healthy and productive lives. May all negative thoughts, words, and actions be smothered with your light and your love as we seek to continue the work we are called to do. As we serve, help us to live each day well and for the glory of you from start to finish. We now go forth in confidence that the work of the Hope Center is in your hands as we serve as your agents. We pray this in the name of Jesus Christ of Nazareth, in whom I believe. Amen.
Amen.
Well, I feel like we can go home now. I feel like we had the benediction. So
I'm going to grab the mic. That's beautiful. Yes, Dr. Shaw.
But thank you for you guys for the kind introduction and welcome. And I come on behalf of the Prince George's County Health Department, and I'm so excited to have the Hope Center as led by this awesome team, including Dr. Neverson, with whom I'm on a couple of work groups, we're just really excited to have the CCBHC, the Certified Community Behavioral Health Center model in Prince George's County. Knowing it's a national model and SAMHSA funded, we are just extremely excited. And so I'm just going to be presenting a little bit about our strategic goals as a health department. And these are our strategic goals here. And then a little bit about integrated care and why this is so important and why this is so vital to our community. So this slide here is my catch-all slide as far as what we're looking for and what we're looking to be and do in our county. And at the top you have here integration, and that integration can mean so many things, including mental health and substance use disorder, as well as behavioral health and physical health. And so we know that the Hope Center is looking to do all of that in one center as through the CCBHC model. And so that it's encompassed there. The next is access. And that access involves filling gaps in the continuum of care and increasing rapid access to care as well. And the third is quality, is improving the real and perceived quality of behavioral health services and creating and maintaining a standard of excellence as well. So if you, could we imagine a world where if you considered, say, the middle of a pandemic and a hospital decided that I don't really want to do respiratory disorders. I just think that it's a little too acute. That virus seems like it's a bit much, and people are dying, and we need a lot of extra staff and things. So we're going to pass on taking care of those folks, and we're going to do our regular heart attacks and strokes and other medical conditions in our surgeries, and let another hospital do it. Could you imagine a world where that happened? Well, I mean, that sounds a little bit ludicrous when you think about it that way, but that's really what we've been doing in the worlds of behavioral health and somatic care for all this time. And even when you think about it with mental health and substance use disorder, that we have had it separated in such a way. So if we can just think about how silly this has seemed, and that we really need to move towards treating a person as a whole person and treating people as, and not selecting which parts of them that we feel are the ones that we can take the best care of. So when we think about the importance of integrated services, why is this so important? Why is the center so important? The key pieces are, number one, that it decreases stigma. This is Prince George's County. I live and work here, where we have 1 in 5 of our residents that are foreign born, and the majority are of minority populations. And so we know that minority populations, those who are foreign born, have such a sometimes a higher degree of stigma and are less apt to seek care. So when you put the behavioral health services in the setting where they are going, and whether or not that's either way, either or, depending on behavioral health and medical care, and or the other way around, that it really decreases stigma and says that I'm treating your whole person, and that you are that important that I want to make sure I understand and address everything that's going on with you. And that's nothing that you should be ashamed of. The next piece, which I've already talked about, is this no wrong door approach. That it's sort of silly to live in this world where we have all of these silos when we know that people are experiencing both. It combats health disparities. So we do know that even for those who are dying of overdoses, that in some of our state data and some of our local data, we've seen that it's hard to tell because they're decedents and they're deceased, but we often have a mental health history in about half of the people who have died from an overdose. I think we also, when you look at the chronic pain population, and that you also can see depression is the most common mental health condition in about half of those people that are on chronic pain, opiates for chronic pain. So, when you think about these disparities in health from either the people that are disproportionately dying from opioids, or even those who are on, say, antipsychotics, the medications that we prescribe sometimes in mental health treatment can cause people to gain weight and be unhealthy and have a higher risk of death. And the same just in general, that those with chronic mental health conditions, severe and persistent mental illness, have a higher risk of death, even independent of the medication. So it's really helping to save the lives of those that are the most vulnerable. And thereby it improves outcomes and decreased costs. These are some of the individuals that have the most costly healthcare expenditures, because they are not going in the quote unquote right door and circling through our systems as we would see them to do it. So when we look at the behavioral health continuum, this is my little schematic here. And you can see at the bottom, we have outpatient services at the bottom and emergency departments and acute inpatient psychiatric or rehab at the top. And the other piece that I like to put is that if we go off of the screen to the right, that a lot of these people, often at the highest levels, but even at any of the levels, could be trending into the criminal justice system. And so having a continuum of care that truly meets everyone's needs helps people get treated in the proper system. And as we know with our racial justice movement, that's been resurging, has had a resurgence, that we know that it's important for it to keep people in the public behavioral health system or the behavioral health system. And another key piece of the Hope Center is the crisis continuum, is that the CCBHC model does have a crisis component. So we're extremely excited as well to have people have the stopgap measure here to prevent them from going up to the very top where they may be going out into the criminal justice system. And so we're excited to work with the Hope Center, and we continue to look forward to all that you guys are going to do. So congratulations. This is my hashtag 2020 saying, is that hope is not canceled. Although there's been so much going on in 2020. I even have a t-shirt with pictures. So I just want to thank you guys for all that you're doing. And I love the name, I love the work, and I love that you have chosen to do all this in Prince George's County.
Thank you so much, Dr. Shaw. I really appreciate you talking about the importance of integration. And this is amazing to us. And I want to be able to have you, the next presenter, who is Barbara Banks-Wiggins, is to talk a little bit about the partnership that we have. As you'll learn a little bit later today during this presentation, as a part of our model, we have to partner, or we choose to partner with different organizations so that we can have that continuum of care and have a smooth transition of services for those that we serve. And Barbara Banks-Wiggins is one of those partners. I know I have another partner on the call too, Stephen Flynn with our iMinds that will provide ACT services. But Barbara she has over 30 years of experience directing award-winning multi-specialty healthcare operations and managing multi-million-dollar budgets. She is the founding executive director of the Prince George's Healthcare Alliance, and she has so much expertise when it comes to population health and care coordination program development, interagency collaboration and community engagement, practice transformation and information technology adoption. Barbara designed, developed, and implemented the care coordination and community health worker program for the Prince George's County Health Department's Health Enterprise Zone Grant and the Prince George's Healthcare Alliance, addressing clinical, behavioral, and social determinants of health for high-risk, high-needs patients, resulting in substantial reductions in hospital visits and costs. She's also the recipient of the 2019 Health Quality Innovator of the Year Award for Best Population Health Program in Maryland by HQI, the state QIO, and recipient of the 2018 HQI Award for Best Patient-Centered Care Program in the state. So her energy is contagious. Her love for the work that we're doing is contagious. And I am so excited to have her on board. Our team is extremely excited as well to include as you've heard from our CEO, Russell Snyder, and I also am so excited to have our board director on the call as well to hear some of the exciting work and the partners that we have, Dr. Sharon Jones-Eversley. So I'm so excited to have her and her leadership on this call as well to hear about some of the amazing partners that we have. So without further ado, Barbara, I'm going to turn it over to you. So Donna, are you able to unmute Barbara? Barbara, can you?
I'm sorry. Thank you, Dr. Neverson. Thank you for that wonderful introduction. I really appreciate it. I'm so excited to be here. Would you like for me to present and sharing from my screen, or will you advance for me?
We will advance. Just say next
Okay.
slide and we'll go ahead and advance for you.
Wonderful. Well, first of all, I want to acknowledge the wonderful representatives of the Prince George's Healthcare Alliance who are on the call now. On behalf of our board chair, William Shipp, and our deputy executive director, Janine Jackson, who is on the call. We also have our social worker, Wanda Smith, participating in the ribbon cutting, just to show our excitement for the Hope Center. We've got our program coordinator, Tasha Barnes, and we also have our wonderful community health workers, Cedric Jones, Ventura McLee, Tanisha Kendricks, Janelle Gerald, Angelina Chappelle, and our insurance navigator, Edith Linares. So we are excited to be here and to share with you and the community what the community health workers' value and role is in Prince George's County. Next slide. So you can go on to the next slide. So the Prince George's Healthcare Alliance is an award-winning 501c3 nonprofit organization. And our mission is to decrease overutilization of health system resources and maximize the quality of care for high-need, high-utilizers of healthcare resources. We train and deploy community health workers who really help patients improve their health behaviors by delivering evidence-based interventions. And I'll tell you a little bit more about community health workers. Next slide. So what is a community health worker? I know a lot of people have heard the term community health worker, caseworker, care manager, but they are members of the community who work with patients to really help them change their behaviors, improve their choices, and make appropriate lifestyle support changes. They work to increase a patient's awareness of their chronic diseases, the risk factors that impact their health outcomes, and really help them better manage and self-monitor their health. Next slide. So by design, the community health worker model really seeks to eliminate the health disparities that a lot of vulnerable populations face, and the barriers to care that a lot of patients have to deal with on a regular basis. Community health workers really build relationships with the patients and help them to identify and address the social barriers that contribute to poor health. Community health workers are individualized support for patients by developing individualized care plans, providing care coordination, building relationships with medical and behavioral health providers in the community so that we can then connect the patients to needed support services in the community. We help educate patients on programs and services that they're eligible for, but most importantly, help them to increase their knowledge of their conditions, help them with a range of activities like outreach, health literacy education, and social support. So the value of community health workers is to serve the patients in need. Next slide. So the reason why community health workers are so critical in this age of healthcare and support delivery is because of the determinants of health. This slide shows that 40% of the predictor of someone's health outcome is based on their social and economic factors. 30% is based on a person's health behaviors. Clinical care represents 20%, and physical environment factors represent 10%. The predictors of health, such as income, education, insurance, age, smoking, places of residence, these all, coupled with the ongoing relationship with the physician, represent a person's determinant of health. Now, while the healthcare industry focuses a lot on reimbursement and payment of clinical health care, which represents 20% of a person's determinant of health. 70% really is focused on social and economic factors and health behaviors. So that's where community health workers come in. Next slide. Our vision is to help patients and residents change their health behavior and achieve their best health. We work with hospitals to help with care transitions from hospital to home. We help that patient in the home to identify what they need in order to have a successful transition, connect with a primary care doctor, and then start to improve their health and health decisions and understanding of their conditions. We help patients who have chronic illnesses that are not in good control. They have issues taking their meds, unmet behavioral health needs. Primary care physician, either they don't have one, they haven't seen one, or maybe they don't have any insurance, which really impedes their ability to have access to care, access to quality care. So these very high need patients have multiple ED visits, 911 calls, and we are there to serve their needs by focusing on their social barriers. Next slide. So when a patient is admitted to a hospital, they get better. Why? Because of great doctors? Yes. Because of great nurses and staff? Yes. But most importantly, when they're in the hospital, all of their needs are met. They have a warm place to sleep. They have 3 meals, nutritious meals aligned with their dietary requirements on a daily basis. They have someone who comes and gives them their medications when the time it is for them to take their meds. If they need to have an x-ray, they have transportation come and pick them up from their room and take them to the radiology suite. All of their needs are met when they're in the hospital and they get well, and then they go home. Some people go home without that social support and without those social needs. Next slide. So what the Hope Center and the Healthcare Alliance partnership will do is help coordinate all the care that a patient needs. As Dr. Shaw mentioned, the whole person care. So when the Hope Center staff conducts the social determinant of health screening and identifies that there are social needs facing a patient, such as no insurance, no primary care doctor, etc., then the Healthcare Alliance will conduct a more detailed intake and address the social determinants that are impacting the patient's ability to manage their entire health. We create interventions and support the expanded care coordination model of the Hope Center and assist with engaging the patients, the family, and that valuable Hope Center care team. Next slide. So this is an example of how a community health worker can help Hope Center patients address their social barriers. So the patient may have a challenge, poor control of their chronic illness. We will help patients better understand their condition, teach them self-management skills, and then motivate them to adhere to the treatment plan that their providers have placed them on. If a patient needs family support, social services, or food, we assist them with applying for services and connecting them to the resources. If there's a high-risk patient with unmet behavioral health needs, we want to help them acknowledge that they've got this behavioral health need and that we want them to connect to specialty providers and make sure that they connect, build that relationship, and we do routine wellness checks to follow up to make sure that that relationship and those appointments and everything are kept. So for high-risk patients who need medication management, we'll follow up with the physicians, the counselors, the pharmacists, and help them get the support that they need. If their patients have no primary care physician and care gaps, we help them select a primary care doctor, make sure that they schedule those appointments, prepare for their visit, If they need transportation, we help provide transportation, and then we'll always do those follow-up checks to make sure that they are adhering and following up on their health, advocating for their health. And then patients with no insurance, we get them insured. Again, understanding and helping them to understand how to use their insurance and how to best use their insurance coverage to meet the needs of their healthcare needs in their family. Next slide. So we know to do this, it takes a lot of community partnerships and collaboration. And this is just a list of all the wonderful Prince George's County partners that we work with on a daily basis in order to help get the needs of our patients met. Next slide. So community health worker and their support for addressing the social issues that are facing high-risk patients really drives down costs. There's evidence that integrating community health workers into the care team is a very strong and successful model. Research has shown that community health workers on the teams are effective. One study showed that the return on investment is 1.8 to 1 for underserved populations, with an average saving of about $17,000 per patient when you address their social determinants of health. The slide and the graph on the right just shows for Medicare patients in a 6-month pre and post in 2018 who were admitted to community health worker services through the Healthcare Alliance, drove down costs in inpatient admissions, ED visits, and observation stays. Next slide. So we also know that it takes a lot of work for community health workers to work with patients and to transition them into a healthier focus and adopting healthy lifestyles. As you can see here, we in 2019 addressed over 1,900 interventions, enrolled nearly 3,000 people in insurance, addressed over 1,000 barriers. But you know what it takes to do that? 3,000 phone calls, over 400 home visits, over 300 text messages, emails, and a lot of provider contacts. So getting a patient from a poor health status into managing their health is an important commitment, but also it takes dedication and support. Next slide. So as we stated earlier, our community health worker care coordination model was recognized in 2018 and 2019 by health quality innovators by helping us to achieve the Health Quality Innovator of the Year award. And we could not have done that without the wonderful hard work of our community health workers and our partners. And we are truly looking forward to serving in the Hope Center. Next slide. So our goal is to serve the needs of Prince George's County residents, enhance the Hope Center's care coordination services, and then help to improve health outcomes and reduce costs in Prince George's County. Congratulations, Hope Center. We are so excited to be a partner.
Thank you so much, Barbara. We look forward to combining. We understand the importance of the social determinants of health. We also understand the importance of making sure that we look at somatic health as well as behavioral health, as well as substance use, all together as looking at the whole person is what we've been talking about to our stakeholders, to our internal team, to anyone we can talk to. So this is so exciting. So I'm gonna go and talk a little bit about, I think, Donna, we're gonna do a poll. Is this now that we do the poll, Donna, or not yet? Okay, so no, not yet. So let's go ahead and let's see. So not
Sorry,
yet.
it is. Or do you want me to wait?
Yeah, let's wait until I get to slide 18.
Okay.
Good morning, everyone. I am Dr. Cheryl Neverson. I am the Vice President of Maryland Programs for Volunteers of America, Chesapeake and the Carolinas. And I'm so excited to be able to share with you today about what we are doing with the VOA Hope Center. Next slide. So just a little bit of history about what you might hear us say CCBHC. It took me a while to get that all in one breath, but what that is a certified community behavioral health clinic. These were created through an act, just the Excellence in Mental Health Act. And so since this time, Congress has appropriated yearly funds since 2018 for 2-year certified community behavioral health centers as far as expansion grants are concerned. And so as it stands right now, there are over 200 of these types of clinics operating in 33 states. Next slide. So our approach to care, what we wanted to be able to do is we wanted to be able to offer integrated services to our clients to improve the quality of services. And again, you've heard this throughout each presenter talking about that no wrong door mindset. We wanted to build on the current services that we were already offering at Volunteers of America. And we wanted to add that critical piece with crisis mental health, SUD, and primary health services. We wanted to make sure that these services were all blended in one setting so that we can have the best and the strongest impact on the clients that we serve. And again, the whole person care is what we are looking at when we're working with our clients. And so in order to improve coordination and communication amongst all the providers and to improve the overall care for our clients, we decided that this was the best approach for us to take. Next slide. So as I mentioned to you earlier, there are over 200 of these types of clinics. If you can see, it started off with 8 states that were demonstration states. Since that time, it's moved to 10 demonstration states in the dark blue. Maryland is one of the states that received an expansion grant. And so what that means is the ones in dark blue, they have some arrangement with Medicaid for higher level of pay. And right now, Maryland and all of those blue states are on a trajectory to be able to work to become a demonstration and just even remove the word demonstration and make this a way of how we treat behavioral health and primary health. So we want to say this is a movement. We want to turn this whole map into dark blue where everyone is providing this level of care to all of the clients, the integrated care model. Next slide. So we have, a part of our name is we never gave up hope. So when this award first came out in 2018, we applied and we were not funded. However, we knew that this was a model that was near and dear to us and we wanted to pursue it regardless of whether we were awarded the SAMHSA grant or not. So we took the feedback we received, we strengthened our application, we strengthened our evidence-based practices, our outcomes, and data collection methods. We gave more detail about the targeted area that we wanted to have the greatest impact. We build our experience. So we started doing the work and increasing the level of services and the partnerships. We started to cultivate these dynamic partnerships that we have. And because of that, and because we never gave up hope, we were awarded the grant this year in May of 2020. Next slide. So I want to introduce to you our director for the Hope Center, who's going to talk a little bit about the services, and that is Dr. Daniel Bokikio, and I'm going to turn it over to him. But before I do that, I just want to say thank you. We have on our team, our medical director, Dr. Constance Flanagan, who's on the call too. And we wouldn't have been able to do this without her leadership and support as well. Thank you so much, Dr. Flanagan. Okay, Dr. Bakiki, I'm turning it over to you.
Hey, thank you, Dr. Nevison. It's a privilege and a pleasure to be here today and on this happy occasion, which is the ribbon cutting for our new Hope Center. As Dr. Nevison was explaining, there are this is a new and exciting concept in behavioral health, mental health, and somatic health management. This is an integrated system and an integrated approach, which is, new and refreshing, and I'm very excited about it because I think it's really the way we should be doing business and how we should be planning for our planning for taking care of our patients. There are 9 required services to be a CCBHC. The VOACC has been in business for quite a few years, and many of these services, I would say about 4 out of these 9, we have been providing in the past, and we developed some expertise at doing them. However, under the concept of a CCBHC, there are at least 5 services on this list which are either brand new to us or extensively modified or expanded from services we have provided. And for example, crisis mental health services is a needed service in this area, and that's brand new to us. Same thing with providing primary care screening and monitoring and basic primary care services. Before this, the VOACC of Maryland was not providing primary care services to our patients. And like I said, the model of a CCBHC requires us to take a look at the whole patient, the head, the heart, and the mind. So this is a wonderful opportunity for us to bring in more primary care services out to patients who need it, and also on the mold of one-stop shopping or no wrong door. If you come in the door for one of our services, while you're here, perhaps we can provide you another service which you need or did not even know that we were able to provide to you. For example, substance abuse disorders. As we all know, substance abuse disorder is a national crisis. And with the advent of COVID-19, that problem has become even greater as individuals are not able to access the care that they need and the support systems that they need to address their substance abuse disorders. Next slide, please.
Before we go on, let's take a poll. Donna, could you release the poll? I want to see how much you know so far about what a CCBHC is. Can you take a minute to answer the poll? Thank you. Okay, go ahead, Dr. Bakiki.
Okay, great, thank you. Here's our new location in Greenbelt. We are literally in the process of still moving in and painting walls and getting carpet put down and picking up some furniture and outfitting the clinical side. Literally, I was working on a medical equipment order yesterday. They've been delivering our medical equipment, left and right. So we have, it looks like Christmas time in my clinical office, as we have a collection of boxes that need to be unpacked. We're located here on the 2nd floor. Excuse me. This was a location that Volunteers of America was previously using on the 1st floor, so it may be familiar to some of you. So this is a wonderful opportunity for us to get in with a fresh coat of paint, new carpeting, and build something that's nice and cute and shiny. And I'm very pleased with the way the office, both the clinical sides and the administrative side turned out. I think it will provide a nice environment for providing services to our clients. Some of the other expectations of being a CCBHC is to establish an advisory working group consisting of individuals who have not only professional expertise, but also bring life experiences to the table. Some individuals have had challenges in their lives and have learned a lot from those, and they have the inside track on what it's like to have that particular problem, and they make a lot of value added to being part of our team. The third expectation for us is currently we're operating on a SAMHSA grant for the next 2 years. Well, there comes a point in time where we have to become sustainable. And that's high on my priority list to ensure that when our SAMHSA support runs out, we will still be able to provide both the type and the quality of services that we wish to the community and be able to be self-supporting. Next slide. Okay, we don't do this. We don't do this in a vacuum. We don't do it by ourselves. This requires collaboration with a lot of other entities out there. Some organizations we have obligations to comply to collaborate with, such as the Ryan White Foundation for HIV and AIDS. Another requirement for CCBHCs is to address some degree of preventative medicine and preventative medicine to deal with public health issues such as smoking. This will obviously be a smoke-free campus, and one of the services I'm looking forward to bringing to our behavioral health and mental health and substance abuse clients is smoking cessation services. Next slide, please. Okay, this is one of my favorite slides. This wheel, it might be a little bit difficult for some of you to read. It may be a bit of an eye chart, but I think what it really shows, and the take-home message from this, is these are all related services. No matter which door you enter, no matter how you come into the circle, if you come in for substance abuse or substance abuse related issue, you come into the circle, and we will make other services available to you based on your needs. And we'll be doing it in as much as possible, all under one roof. We don't do that, it's like I said, we don't do that in a stovepipe. We do that with our relationships, with collaborative and cooperative relationships with other entities out in the community, professional social help organizations, other volunteer organizations, and other nonprofits. But like I said, no matter which service you come in for, we will ensure that you get all the services that you need while you're under our roof. Next slide. Okay, pending your questions, that concludes my short briefing.
Thank you so much, Dr. Bakikio. We have another poll for you. Donna, if you can launch that poll. So just to check in, how you doing so far? Thank you. I do want to introduce, if she's still on the call, one of our clients who wants to talk about the work that we have done here with her, with the Hope Center. So I will go ahead and talk about, have Miss Jennifer Parrott come on, and then after we have that, Donna, we can go back and we can go through what kind of goals we want to accomplish. So Jennifer, if you are on the call, if you can unmute your phone or screen and just kind of tell us a little bit about yourself and why this is so important that we address the whole person.
Okay, hello, I'm Jennifer Parrott. I've been here for 4 years and I've been in rehabilitation, dealing with rehab services like psychiatrists and, therapy for over 10 years. I feel like it's a very important thing for me because it helped me with stability. Like, there was a couple of things that my family members, especially my mother, was noticing about me that wasn't usual behavior, and it was questionable. And I couldn't see it for myself. So I was in denial and I was saying, no, I'm not. No, I didn't. Like, I don't know what you're talking about. But until I started speaking and talking with someone on a regular basis, it really started to help me to see all things on a different angle. So that's why I think that therapy is important to me. It is also needed because it could help you to, get through day-to-day life difficulties. As far as drug abuse is very needed when you have been through that. And I do play a key factor in that as well. So I do use my therapy. I love talking to Ms. Neverson every time she calls. Um, and I think that this is a good program because so far throughout the few months, 6 months that I've been dealing with Ms. Neverson and my therapist, my psychiatrist, I'm sorry. It's been very hands-on. Everybody seemed like they're caring and about me and what my difficulties are. I've been, my conversations with them just doesn't go. Hello, how you doing? I really take my time and put in a relationship, having them to completely understand me and what I go through. So that's just all I would have to say about it.
Thank you, Jennifer. We really appreciate you coming on and sharing your experiences, because it really just hits home to say how important it is for all of us to be on the same page. And we've seen it in action when we've had to call Dr. Flanagan, the therapist. Dr. Flanagan is our psychiatrist. So we've been able to, without hesitation, to be able to rally up our team and just wrap our hands around our clients and give them that total care support that they need.
And I especially feel it with y'all.
Thank you so much, Jennifer.
You're welcome.
And and your testimony really, talks about how it's really, we can do all of the talking, but until we hear from people who receive the services that help us make us determine what type of job we're doing. So I really appreciate
until you open up and really take and accept it, you won't be able to help yourself. Because at one point, I was just going to child psychiatry and I really didn't know what it was about, psychiatry. I was like, oh, this is boring, Mom. You got me talking to somebody. And I really didn't understand it. But as I got older and became a mom of my own, I really do kind of find it enlightening because I get to let out all of the built up steam and things that I don't understand about, my mental health diagnosis, and you guys really help enlighten me on what my problem and issues are, and that way I can rearrange and fix it, So
thank you so much for your time.
You're welcome.
Yes, I'm gonna go back, Donna, and just talk about, so what are our goals? What's our purpose for the Hope Center? So it's pretty clear. So VOA, we will coordinate care to provide Prince George's County residents. Let me just add this. The SAMHSA grant is geared towards Prince George's County residents, but because of the scope of the work that we do, we have two centers. We have a center in Prince George's County, and we have a center in Baltimore. So we're able to target those particular populations, Baltimore as well as Prince George's County. So the services that we provide with the Hope Center will be also services that we provide with in Baltimore. Ms. Jennifer is with our Baltimore program. So, and with this Hope Center, there's no wrong door. So you can come from Howard County which we have clients, Montgomery County, New York. It doesn't matter where you're from. So we look at early intervention, treatment, and recovery. We leverage our technology, and we work with adults, children, and our veterans. And our goal is 500 unduplicated individuals annually. So Dr. Bakiki, I'm gonna pass the buck to you to talk about those 3 types of areas that we're gonna look for to address with the Hope Center. Next slide. You're on mute, Dr. Bakiki.
Yes. Take my glasses off, I can see, but I can't see the computer anymore. Right, put them on, I can see the computer and I can't see anything else. It's tough getting old. Anyhow, obviously, a couple of areas that we could talk a little bit about is increasing awareness and understanding. If you're providing services in the community, the first thing you need to do is you need to make people aware of the services that we provide. And that's kind of, plain and simple advertising. Folks out there have to know that the Hope Center is now here, and they have to be made aware of the types of services that we can provide to them, regardless of their ability to pay, regardless of any other socioeconomic background. We're here for everyone. The other issue is when you're dealing with behavioral health that's important is there still remains a lot of stigma associated with asking for behavioral health, mental health, or substance abuse assistance. And to that end, Dr. Neverson has initiated a anti-stigma campaign, which we hope will help educate individuals to the services that are available and help eliminate some of the stigma associated with asking for some types of behavioral health or substance abuse services. As a 30-year commissioned officer in the Army, I can tell you among veterans and military personnel, despite the best efforts of the Department of Defense and the Veterans Administration, there still is a lot of stigma associated with asking for assistance in the behavioral health arena. Many individuals are afraid to ask for help because if you go into the military healthcare system and you ask for help in this area, like everything else, it gets annotated in your military medical record that you're suffering from anxiety or depression, or you think you're drinking too much, or you're having family marital problems, or child problems, or any of the other common things that we see in the community. So the Department of Defense and the Veterans Administration at one point wisely realized that this was a barrier to care, and they started initiating a program where you can get and ask for assistance that's outside of your military healthcare record. And the Hope Center, veterans and military personnel are a key target clientele for us. And we will also like to be able to offer that type of service where if you come in for help here, it does not appear on your military medical record. And that'll eliminate a very large obstacle for not only veterans, but for active duty military personnel who are concerned, either rightly or wrongly, that if they ask for that type of help, somehow they will be stigmatized in their military careers, that they're asking for help with behavioral health, substance abuse, or mental health or marital problems. So that I'm really looking forward to bringing that type of service on board. As the previous state surgeon in the Maryland National Guard, I know that many of my soldiers wanted help, but were concerned about asking for it. And if they had a vehicle or a location where they can go and ask for help, that would be very beneficial. Next slide, please. Okay, no wrong door policy. I think no wrong door policy is key. I think it's a key concept, and I think it's a concept, that's really going to help us out and help out clients coming into service for services. No wrong policy basically means if you walk in the front door and you ask for a service, if we provide the service here or we can provide it within our network, we're happy to do that. If we do not provide that service here, we will find somebody that does through our network of collaborating agencies, entities, other consultants, other organizations out there, both public and private, that can provide that service to you. And we will provide a warm handoff. Now, what do I mean by a warm handoff? I can tell you what a warm handoff is not. A warm handoff is not saying, I'm sorry, we can't help you here. You need to go someplace else. That's not a warm handoff. A warm handoff is saying, gee, we don't provide that service, but hold on, I will find somebody that does provide that service for you, and we will make contact with them and give you a warm referral to that organization and set an appointment up for you with them and arrange to make sure that you can get there. Many individuals, they'll work themselves, they'll work up the courage to come in to ask for help. And if they get told no at that point, you'll lose them. They'll go back out, and they won't come back in because it took them enough and an effort to work up the courage to ask for help. And you said, no, I can't help you. They wander off and they feel defeated and they don't ask for help again. This, hopefully, the no wrong door policy will help preclude that from occurring. We recently, very recently, joined an entity called Unite Us, which was sponsored through a private healthcare company that provided the service to us at no cost. And so far, it's united us with 150 and growing number of community organizations, nonprofits, social organizations, other NGOs in this metropolitan area that provide a vast array of services, from food, transportation, clothing. That's going to be a great asset in our warm handoff abilities, because we can go right into the network, find somebody that lives or somebody that works or has a capability near where you live or work and connect you with them. So it's actually a very nice tool. The folks that developed it did a very nice job of modeling this and putting it on a map, so we can just plug in a zip code and find the service that's nearest to your house or your place of work, and then we can set you up with them. So that's good. That's excellent, and I'm really looking forward to working with them and being able to provide services, across the entire Baltimore, Washington corridor. We've hired a nurse practitioner and an RN. I'm very happy to say. I'm a physician. It's nice to have additional support and help in the organization. Our nurse practitioner will be able to provide those primary care services that are critical to dealing with individuals who have other issues in terms of being able to provide the full spectrum of care to them. Next slide. Okay, improving health outcomes. Like I said, we're under a SAMHSA grant. SAMHSA has leveraged a reasonable amount of data requirements from us in data analytics. I think that's key. We are very quickly moving in healthcare to an evidence-based system. And what is an evidence-based system? An evidence-based system is, and I can tell you because I have a little bit of gray hair and I've been in healthcare for a long time, a lot of things that we used to do, or a lot of things that we still do in healthcare, we do them because that's the way we did them, because that's the way I was trained back in the 80s. So evidence-based system will help move us away from that. Not that what we do is wrong, but it's nice to know that what I'm doing and the interactions and the interventions I'm taking today are actually scientifically shown to improve outcomes. Because like I said, a lot of times we do things because that's the way we've always done them, but we've never really challenged, does this therapy or this technique really do some good for the patients? So with the evidence-based system and the gathering of data and data analytics, we'll be able to look at, is what we're doing changing outcomes? Are people getting better? Are we improving lives? And I think that's critical. And the only way you can do that is by doing analytics on the data and showing that, yes, this does help. And if it does not help, then it's something that we're not going to do anymore, or we'll modify it so it does help improve outcomes. Let's see, Ryan White is a key partner for us in the management of HIV care and treatment in the community. And I think I already mentioned, smoking cessation earlier. Monthly routine screenings for HIV and viral hepatitis are also very important. Although many of these diseases are not curable, they are manageable and they are treatable if you can get the individual in and you can make the diagnosis and you can get them into therapy. You could prevent many of the complications, especially with HIV and hepatitis, that occur if the individual goes untreated and unmanaged for a long period of time. In addition, it also we can also decrease the risk of further and continued spread of various infectious diseases. Okay, next slide. Okay,
Next slide.
back to you.
Thank you so much. So I just wanted to say thank you for being a part of this. Thank you to Candace Vanderwater, who's our COO, and her leadership through this. Simone Blanchard, her tireless efforts to get this up and operational is so greatly appreciated. And so at this point, please, if you have any questions, unmute yourself or you can put it in the chat box and we will be happy to answer any questions for you. One question was, will dependents be an interest in the future to receive services? They're an interest now. So we have a no wrong door policy. Whether you have insurance, whether you don't have insurance, the agencies who we partner with, we want to make sure that our doors are open to anyone. So that is key. I wasn't sure. I'm going to give, if Candace is still on the call, if she wants to say a few words, or our chair of our board, Dr. Sharon Jones Eversley, I would like to open the opportunity for you to say a few words.
Do you want me to go first, Cheryl?
Yes, please.
Hi, this is Candace Vanderwater, as Cheryl mentioned. I'm just incredibly excited to be a part of the process, and this is such important work. We are very pleased. We're very excited about our community, our partnerships with all of our partners. I look forward to hearing all of the wonderful, successful stories about how we impact people's lives at the end of the day. So thank you all for joining us today. Cheryl, the entire team, congratulations, and thank you to our partners.
And this is Dr. Sharon Jones Eversley. I'm a social epidemiologist. So in public health, this is just what we do. And on behalf of our entire board of directors of Volunteers of America, Chesapeake and the Carolinas, just expressing our gratitude to you all for attending today. But not only that, but the value that we do know from learned experiences about what works and what does not work. And this isn't just a holistic approach that's rhetorical. It's really about saying there are no wrong doors. We will not lead you to a place that's a dead end. Our goal is to help. And just like Dr. Shah had said before, hope is not canceled. Even in this unprecedented time with COVID-19, I am just overjoyed and so grateful to God for such a time as this. It's been a long time coming, but it's so needed in the way that we have to pivot and continue to learn how to enhance our quality of direct services, because people are not dissected by their anatomy. They don't just come in with an arm and an eye, they come in as a whole person. And being able to minister based on the expertise of our staff and our mission as a church without walls is just an incredible opportunity. And we thank you all for participating in our virtual ribbon cutting, but so impactful. It doesn't even seem like we are virtual, because the energy, the information, the support, and the relevance of this important time is just such a blessing. So thank you all in advance, not just for today, but for your continuous support and your prayers for the Hope Center, where hope is not canceled at all. Thank you so much for everyone, the staff, for everything. We're just so excited about what God is doing. Thank you.
Thank you so much, Dr. Jones-Eversley. A couple of questions. I see here, will the clinic offer COVID-19 testing? So the answer to that is, it's a possibility. I know that we put in for a grant with Johns Hopkins University. So we're waiting to hear back from that to be to use testing in one of our programs. I also will leave that up to our medical team to decide if this is a, an opportunity for us to take a part of. Dr. Bakikio, do you want to address that one as well?
Yeah, I would leave it in the realm of possibilities, and we'll wait to see what we get back from Johns Hopkins.
Yeah, what we are doing is we are working on having the flu shot as one of our interventions with the Hope Center. So we are in the process of getting information to provide to our clients on site at some of our housing programs to be able to provide the flu shot.
Yes, that we'll be able to do in the very, very near future. Next couple of weeks, we should be able to set that up.
Great. Another question was, most clients' medical assistance does not cover dental care. Will this be a possibility in the future? So the answer to that is, all possibilities are open. I know with a couple of other clinics that have CCBHCs, they do offer dental care services. Because this is our first time offering the primary care component, we want to stand that up first and get that off to a strong start. And in the interim, we will partner with dental care providers who can work with our population. But I do think that that is a great question and for us to put as far as consideration for future services. Another question is, what if a client has private insurance and cannot pay for their co-pays? Can a client obtain therapeutic services with the Hope Center? The answer to that is yes. We are in the process of being credentialed for private insurances. And if a person is not able to do a copay or pay for services, we will have a sliding scale fee, and we will post that on our website. Other questions?
Yeah, Dr. Nevison, Dr. Wakikio. I happened to notice a question here regarding dependents. Yeah, I read it, first time I read it, it escaped me. But yes, my assumption is when you're talking about dependents, you're talking about military dependents. And the answer to that question is yes. You know, however, having said that, we need to get empaneled with TRICARE East and their third-party service so that if we can bill for services. But even before that, yes, if you have a dependent that needs service, we'll be happy to see them.
Well, while you think of other questions, I am going to share with you what we have coming up next, what to look for. So Donna, if you can share this, the People Like Us campaign slide. So this is what's next. I am so excited about this. As a part of our outreach, we have developed an anti-stigma campaign, which will launch in November. And our slogan is People Like Us. And what it means is that we are all a part of this, this mission. So we want to make sure that people know that you are not alone. We are in this together. And this campaign, which will be composed of not only print media that will be shared not only on our website and social media forums, we're looking to get other types of news coverage for our launch for our anti-stigma campaign. But we are also doing, coupled with this, some short videos. So you'll see not only the print media, but you'll see videos that will represent what we mean by people like us. And so this is going to be simply amazing. We have some partners and community partners that will help us with translation of some of our media. We also have possible partnerships as far as making sure that this is viewed with our community, our end users, to make sure that it's really hitting, getting the message out that we really wanted to receive. And along with our anti-stigma campaign, we will have a series of webinars that will target different areas and different populations that we will be having coming up, commencing in November, before the end of this year. So we are really excited to have everyone to participate in what we're doing as far as the webinars. And our goal is at the end of the grant that we can culminate with one, just like a conference where people can come and we can talk about some of the work, share some of the data, and talk about some of these things that we've been doing. So I'll go back and I will answer any other questions that you may have. And I think we have a question in the chat box. When do you expect to see your first patient? And when does the campaign begin? So we started September the 1st to see our first clients within this center model. And so we've started with some of our clients that were already in our programs with Volunteers of America, because as our CEO stated earlier on, we already have clients that are in some of our housing programs, in our group home services, in the community. So we've linked them to what we're doing with the Hope Center. But referrals are open now, and we will see clients now. The one service that has not launched, but we'll be launching within the next week or two, is because we're building up our medical equipment and supplies, is services coming into the family nurse practitioner. So that should be up and operational in about what would you say, Dr. Bakikio, maybe 2 to 3 weeks? Any other questions? Well, I truly thank each and every one of you for this moment, for this opportunity to share with you the wonderful things that we are doing. We are looking for, to continue to strengthen our partnerships. And I really want to just say thank you. I have one last poll that I want to be able to launch for you before we end things out for today. So Donna, if you can launch that. So do you feel that you learned something interesting today? And if you didn't, please email us and we will continue to talk until you just as excited as we are about the work that we're doing. And if you have any questions, comments, or concerns, we will be happy. We are happy to talk about it. We are happy to come share about the work that we're doing. And so I just want to say thank you all for joining us today. And you will be hearing from us again really soon. The anti-stigma campaign will launch in November. So we're looking at mid-November. So right before Thanksgiving, you'll start to hear something about our campaign. And we will notify you, if you register for this event, we will notify you of the things that's coming up as far as our anti-stigma campaign and our webinars. So spread the word. We are looking forward to working with you all. And thank you so much and have a wonderful weekend.
You too.
Thank you.
Thank you. Great job, Cheryl.
Thank you.
Have a great day. Great job done.
Thank you.
Have a good weekend.
Thank
Thank
you.
you. Have a good weekend.